Welcome to This Explainer. You know that moment when you're sitting in a doctor's office, they hand you a clipboard and you just kind of sign on the dotted line without actually reading it? Well, today we're going to change how you look at that paperwork forever. We're diving into the Dubai Health Authority's guidelines for patient consent. And the goal here is to empower you with a crystal clear understanding of your rights and the strict regulations that protect you in the healthcare system. Now, everything we're covering today comes straight from the official source, the Dubai Health Authority. And look, their overarching strategy here isn't just about creating a mountain of red tape. It's really about pioneering a completely human-centered health system. Their documented mission is all about promoting trust, safety, and quality care for patients and families across the Emirate. So everything we discuss today is firmly grounded in this official legal framework. Okay, so here's our roadmap for today. We're going to cover understanding informed consent, when consent is required, medical emergencies and exceptions, who can give consent, and finally, patient rights and documentation. Let's get right into it. Starting off with Section 1, Understanding Informed Consent. This is really about establishing the core foundation of body autonomy. So the absolute crucial takeaway here is that a quick scribble on a piece of paper just doesn't cut it anymore. True informed consent means you're getting full transparency from your doctor. We're talking complete information on the nature of the procedure, the risks, the potential side effects, and importantly, the alternative options. All of this has to be laid out crystal clear before any treatment even begins. But that begs the question, right? Who actually has the legal power to make these choices? Well, the authority is anchored at the 18-year-old threshold. A competent patient is defined as an adult, 18 and up, legally capable of making decisions. On the flip side, an incompetent patient is someone who lacks that legal capacity, like a minor, or someone who maybe lacks the cognitive ability to provide that informed consent right at the time of the procedure. All right, moving right along to Section 2, when consent is required. We're going to look at specific everyday medical scenarios where your doctor is legally required to stop and get your signature. Now, you're probably pretty familiar with some of these standard situations. Written consent is an absolute must for pre-op assessments, surgeries, anesthesia, and intense treatments like chemotherapy. But take a closer look at the end of that list. The regulations have actually adapted beautifully to the modern world. You now have to give specific consent for telehealth services and get this, if a clinic wants to use your pictures or videos in their social media ads, no way they can just post it. They legally need a completely separate, specific written consent from you just for that purpose. Now, here's a really fascinating, highly specific time frame for you. Picture this. You're scheduled for an elective surgery, something planned way in advance. Your pre-op consent is actually only legally valid for a maximum of 30 days prior to the day of surgery. If more than 30 days roll by between your signature and the procedure, the clinic literally has to sit down and go through the entire consent process with you all over again. Let's escalate the stakes a bit with Section 3, Medical Emergencies and Exceptions. We need to look at edge cases where standard rules are temporarily bypassed. So let's contrast a standard elective procedure with a high-stakes medical emergency. For those elective procedures, the law obviously requires ample time, full discussion, and prior written consent. But under Federal Decree Law Number 4 of 2016, if we're talking about a life-threatening emergency requiring immediate surgical intervention, or maybe a severe public health threat like a highly contagious disease, the standard consent process goes right out the window. The priority shifts entirely and legally to saving your life immediately. But that brings us to a pretty critical scenario. What actually happens if a patient cannot consent for themselves, but it isn't an immediate life or death emergency? Say an adult is incapacitated, or the patient is a minor. Who exactly takes the reins? Well, we're going to figure that out in Section 4, Who Can Give Consent. First off, the DHA guidelines outline a very specific legal caveat regarding reproductive health. While a married female is fully capable of signing her own consent for general procedures, the guidelines explicitly state that for procedures and treatments specifically related to reproductive health, the husband's consent, as the first priority, or the legal guardian's consent is absolutely mandated. This whole system builds a really strict sequential chain of command for identifying what we call the next of kin. If a patient is deemed incompetent, the hospital first looks to first-degree relatives, so a spouse, parents, or adult children. If none of them are available, the authority essentially cascades down the family tree. It goes to second-degree relatives like siblings, then third-degree like aunts and uncles, all the way down to fourth-degree cousins.
And to further break down these highly specific family dynamics, it's really interesting to see how the law adapts to different modern family structures. For instance, if a married female patient is incapacitated, the husband's consent actually takes priority over her father's. In medical emergencies involving children where the father is absent, the mother is explicitly authorized to give consent. And what about divorced parents? Well, for minors in that situation, the parent who holds legal custody is the one officially appointed to make those medical decisions.
Okay, but what if a patient is completely alone in the country and incapacitated? Well, hospitals have to trigger this ultimate safety net protocol. First, they absolutely must exhaust all possible measures to contact any next of kin. If that totally fails, the most responsible physician in charge authorizes the treatment. And crucially, a second healthcare professional has to co-sign as a witness. It's basically a built-in double check to ensure absolute accountability even when family isn't around.
And that brings us to our final part, Section 5, Patient Rights and Documentation. So what does this actually look like on paper? Well, the burden is entirely on the hospital to make sure the document works for you. Consent forms have to be available in both Arabic and English. Plus, they must be written in non-technical language, meaning you can actually understand what you're reading. The form has to clearly spell out potential risks, complications, and alternatives. And a really huge point here, they must disclose all related costs prior to the procedure. They legally have to be transparent about exactly what you're going to owe.
And check this out, because the guidelines build in a financial protection that is a real game changer. As a patient, you are not liable to pay for any medical negligence, hospital-acquired infections, or malpractice. Those financial burdens, they have to be covered by the health facility's malpractice insurance, which completely protects your wallet if things go wrong due to substandard care.
Which brings us to this powerful quote straight from the guidelines: "The patient reserves the right to refuse treatment." This is literally the ultimate expression of patient empowerment. You have the final say over your own body. Now, it is worth noting that if you do refuse, the physician is legally required to document that refusal and clearly explain the health consequences of that decision to you. But at the end of the day, the final choice is always legally yours. So let me leave you with this question. Are you fully informed about your healthcare rights? The next time you're handed a medical consent form, remember, it's not just some routine paperwork to breeze through. It is a legally binding process specifically designed to protect your body and your choices. Take the time to actually read it, ask those questions, and take charge of your health. Thanks so much for joining me for this explainer. And as always, stay curious.